Hi, welcome. What we're going to look at today is a patella tendinopathy, and particularly looking at runners and how we get you doing the right exercises to get you back to running. So quick little summary, here's your knee, kneecap sits underneath, tendon runs over the top, and the tendon particularly attaches through the kneecap and onto the knee. So the point that you're going to getting the problem will be just below the kneecap on the sort of soft tissue bit. It might be you have to press up onto the kneecap. It could be on the inside of the knee, outside of the knee. That doesn't matter, it might be quite central. That's not a problem. We still need to work through building the tissue tolerance up. So what we're going to do is we're going to go through two phases of retraining. We're going to do sort of phase one, a little bit of loading and building up some tissue tolerance and load capacity through the tendon and the muscles. Then we're going to go into phase two, which is really what you want to consider, these three exercises. If you're going to start going back to your running, then I would look at those to try and help make sure that you're ready to start running and loading that area. We also have a Running Logic, a fantastic return to run program that would be advisable to follow that as part of your late stage tendinopathy rehab. So have a look at that on our website. So let's have a look at those exercises, what we can do to make sure we settle down that tendinopathy and get you back running quickly. Okay, so what we're going to look at here first up is the muscle on the inside of the knee, very low down, our VMO. A lot of the problems that we have come to tracking issues back to the patella, which creates a load change in the tendon, which sends the tendinopathy off, obviously at a time maybe where you've had increased activity. So the outside of the thigh, much stronger, much more powerful. When there are issues, particularly if there's any associated movement issues, this muscle can get inhibited, and so we want to try and make sure that that's working effectively for you as quickly as possible. So I've got Travis here. We're going to take 3 steps off a wall, so just find a nice wall at home. You're going to take 3 steps heel to toe, 1, 2, and 3, feet side by side, about hips width apart. Fantastic. And then you're going to reach back and just ease your way back into the wall. Great. We're going to come down, so our hips are just about at knee height. Our knees are facing outside of our big toes facing forwards. And you're going to feel all the quads working, but you will start to feel this. Now, we want you to build this up. So you sit for as long as you can, holding a position. You will see this muscle start to flicker as you're starting to fatigue. You want to engage the glutes, just keep that engagement through there, so just a gentle squeeze. Keep your butt upright, there we go. And we're going to hold it, and you're trying to build up to 3 minutes of work. It will take you probably a couple of weeks to do that. It may take a bit longer, don't worry about that. Just keep working through each day, you'll progress as you go along. When you finish or when you fatigue, push yourself up off the wall, don't slide, so push forwards and come up. Okay, so start with as long as you can. A minute will be a good starting place, and then you're going to build it up to 3 minutes. Okay, now we're going to do some incline work. Incline work, if you're leaning forwards, if you're onto your toes, you engage your quads more, so that creates more stress into the knee and more load into that knee patella tendon. So the patella tendon then is taking the load, we can help improve the tissue tolerance. So what we've got here is an incline board, so Charles is going to come onto that. At home, use books to help bring your heels up so that you can create that same sort of an incline. So you're coming onto that position, and we're going to do static work. We're in a pain phase. We want to load, we don't want to move through until we're happy that the pain is more under control. So come down, okay, and hold. So we're going down into a slightly lower squat. We're going to try and hold that for 20-30 seconds, and then we're going to come up, and then just a little rest, and then straight back down, and we're going to load again. Okay, so we're going to do 2 to 3 minutes of work like this. Rest as you need to rest, come back down, load again. Again, as I said, this is in the early stage of the pain stuff, so you'll find that walking might be painful, running certainly is out of action. We're going to start to load it here. If they find that those things improve, we can start to make it more difficult. So what we do is we come up, and we're going to come onto a single leg. So we'll have the other leg out in front, so we can get our balance. And again, we're going to come down, so we're loading. Again, we've gone to one leg, so we've added rotational control, and we've added more load onto that side. And again, we're going to control it for as long as we can, come back up, rest, come down, and you're going to do 2 to 3 minutes of work. So these are really good places to start when the pain is at that acute phase and really inhibiting you from doing many of the activities you want to get back to. Okay, so we're now going to look at phase 2 of your rehab, and really what we're starting to do now is test, are you ready to go back to try your running? What we want to do is we're going to do a bit more dynamic work. We're going to put the tendon under load when it's working eccentrically. So what we're doing here is, as you're landing, your quads are lengthening and you're loading the tendon. We're asking it to be able to cope with that load. That's so important to make sure we get your tendinopathy to the right place. So we're going to go through 3 little phases here. So at this point, you should be able to pretty much do everything relatively pain-free. You won't have necessarily tried running or sport yet. Okay, so that's where we're at. We're just at that transition. Are you ready to go back? And this is the key. So I've got Travis, we've got a step. You can use a step or something outside a bench to do some of these. It will be quite easy work to do. So what we're going to do first is actually just a dynamic short and jump up onto a step. So we're just seeing whether we've got that ability to contract the muscle on the tendon and put load through it. So we're just going to get you to jump up onto the step and hold. And we're staying in this small knee bend, landing, hip landing position, nice and tall so that the knee is taking that load. So we're concentric work, shortening the muscles, we come up and we land and we eccentrically work and take the load through that tendon. Step back down and go again. Okay, these are individual events, so they should be probably 3 to 5 sets of about 5 jumps with a good rest, so that each one is really dynamic in what we're trying to do. We're loading and working the tendon. One more. Wonderful. Excellent. And then come down. What we're going to do is we're going to take that. So if that's pain-free, tick the box, move on. Next one we're going to do is we're going to jump over the steps. So we're going to jump up, on, and we're going to jump off and land on the other side. So we're asking a bit more load of the tendon as you come off and land down and hold. So Travis, if you can go up and straight off. Okay, good, and hold. Hold for 3 seconds, go around, go again. So I want you to be dynamic. So don't land and stay on the step, on and off. Okay, so nice and quick. Off we go. And hold. Wonderful, excellent. And around one more. That's great. Up, off, bang, land, hold. Okay, staying nice and tall. So that's phase 2. Get through phase 2 and you can do that without any problems. We're going to start on the steps. So we're going to come up. This time we're going to ask you to take that load as you're going down and then you're going to explode straight out of it. So we're coming off the step onto the ground and we're going to do a double leg jump forwards. Nice and powerful. Try and get some distance in there. Okay, so down, land and go. Fantastic. Come around and go again. Okay, so we're basically asking the tendon to take the load, go again. Fantastic. Okay, so you're going to do the same sets, 3 to 5 sets, about 5 repetitions, maybe 8 on each side with a rest. So between each set, go and do something else training wise, come back. Make sure you've had recovery time before you do the next set. Final one, I'm adding in, there's a 4th one. We're going to do a single leg version of that. So we're just going to do single leg, whichever one you want. So we're just going to come down, bang, and hop. Okay? The ultimate landing, running is a single leg activity, so we want to make sure you can do single leg. If you can tick the box on all 4 of these, you're definitely ready to start your return to run program. Okay, do one more for me. Fantastic. Okay, so that really should see you in good shape. Hope that helps. Cheers.